Cody, this is the 6th time that I've changed your diaper this morning, and you just won't keep anything down. I just don't know what to do. Let's talk. Welcome back to Pocketbook Pediatrics. I am Dr. Rochelle Ann Brown, and as usual, I am always so happy to have you here. So we're going to be talking about GE today. Did you get the right answers for what GE is? So we're going to talk about it. Let's break it down and see what GE is all about. So when we talk about GE, we're talking about gastroenteritis. Now, you know I like to break things down. So when we say gastro, we're talking about the stomach or the belly. When we talk about entero, we're talking about the intestines or the bowels, or what we might call tripe here in Jamaica. And anything that says itis deals with the inflammation or the swelling of the area that we're talking about. So gastroenteritis is the swelling and inflammation of the tummy and the intestines. And this usually is caused by some infection, a virus, a bacteria, a fungus, many different causes for gastroenteritis. So what can you expect then when your child has gastroenteritis? Now, when anything is swollen and inflamed, it's not going to do its job the way that it's supposed to do. So when we think about what the job of the stomach and the intestines really is to break down that food that we eat and put it in a form that we can absorb it or take it up into our bloodstream and use all of that energy that's there. But if it's inflamed and it's swollen, it's not going to do that job of absorbing very well. So there are two choices. It's either going to go up or it's going to go down. So if things go up, we have symptoms of vomiting. And if things go down that aren't absorbed very well, it's going to be a lot of fluid and it's going to come out as diarrhea or a loose stool. Okay, so those are the main things that we have when we have gastroenteritis. Now, it is an infection, so there are other symptoms that are associated with it, and we'll talk a little bit about that now. Now, usually GE for our children is caused by a virus, like most of the illnesses that they have. And when it's a viral GE, they tend to have a low-grade type of fever and not really much else. It runs about 3 days, like most other viruses, but sometimes it can last even as long as a week or 10 days, but it's not severe. When it's a bacterial GE, there tends to be a higher fever that's associated with it. And they found that there also is a lot of abdominal cramping or belly cramping, and there can also be some bloody stool that is associated with it as well. And if it's a fungal GE, which is not very common, but it can happen, we find that the symptoms tend to be longer, particularly the diarrhea, the loose stool, tends to be more than 2 weeks that is going on for. So you might ask then, well, how did my child even get GE to begin with? And that's a very good question. And like most things that are passed between kids, it's really easily passed from person to person. But one of the main things to think about when we talk about GE is hand hygiene or hand washing. So it can be passed on if there's not very good hand hygiene, particularly after using the bathroom. Or if you have been caring for somebody who has GE and you've picked it up on your hands and passed it on, it can be passed on in that way. Sometimes it's food that we eat and drink as well, but that's usually if the food is not, well treated or the water is not well treated. It may still have bacteria in it and fungus in it that can be hurtful to us. So those are the main ways that GE is passed on. So you might then say, well, what are the other things that we need to know? So very good question as well. Now, if you have to go on to your pediatrician, we're going to ask you questions like we always do. And this usually is related to what is the characteristic or what is happening with the vomiting and diarrhea. So we definitely want to know how long it's going on for. And then we're going to ask you things like how much vomit is there? How much diarrhea is there? What does it look like? Does it have a particular color, yellow or green, particularly for the vomit? And is there any blood in it, both the vomit and the stool? Is there any blood in it at all? Those things help to kind of guide us into what might be happening, because as you can imagine, GE is not the only cause of vomiting and diarrhea. So we have to be sure that we rule out other things. And then it might be an infection that's not just dealing with the tummy and the intestines alone. Some other infection can cause vomiting as well and diarrhea. So we ask about other symptoms of infection, the fever, how high the fever is. Are there any other symptoms like runny nose, ear pain, lower belly pain that is more, around the bladder area, we would call it. Any other problems with the urine? We ask those questions as well. So it's very important for us to find out exactly if this is just GE or something else that might need some other treatment. Now, you might not think we ask about these questions particularly, but one of the things we're very interested in is the urine, and particularly how much of it is there. Is your child passing the same amount of urine that they would pass, or wetting the same number of diapers they would pass as when they're well, or is there a smaller volume of it? So keep a good lookout for that. And then there are some other very key questions that we ask that are going to get you down to that one thing that we're very, very interested in when you have GE. And those questions really relate to how your child is behaving and how they look. So is your child feeling lighter to you in weight or looking like they have lost weight? Do their eyes look very deep set in their face? Are they easy to wake up, and will they still talk with you, cry for food? They might not be as active and playful, but they still are talking with you or interacting with you. Or are they very droopy and drowsy and very difficult to get awake? Or even something like, has their temperament changed? Are they very angry, or do they seem very confused? Now, all of these things that we're asking you, they get us down to that one key thing, and that really is talking about their hydration. The key thing when your child has GE is making sure that we can keep them very well hydrated. And those things help us to know what your hydration status of your child might be. So let's talk a little bit now about managing that hydration and what's the right thing to do. So as I said, most GE is caused by a viral illness, and it will run its course in a short time. And usually it can be managed at home without needing to visit the pediatrician. So here's how we can try to help keep it that way. So if your child is having vomiting, we want to make sure that we can keep things down. And if they're having loose stool, we want to make sure that they're keeping up with the amount of loose stool that they're passing. Now, every time that they have a vomit or a loose stool, they're losing fluid. We know that, but they're also losing what we call salts, the sodium, potassium, the chloride, those things that they would be getting from the food that they're eating. But if they're not having a good appetite or not keeping it down, they're not getting those things. And if they lose them, then we need to put them back. So in addition to the fluid we need to put back the salts, and the best type of fluid to do that is what we call oral rehydration salts, or for short, salts. And it comes in many forms. It comes unflavored, it comes flavored, it comes as popsicles, which is sometimes easier with the kids. So you can choose a form that's good for you. But if you don't have ORS on hand, coconut water is a good alternative to the use of ORS as well. What we don't want is for you to use juice or sports drinks. And that's because juice and sports drinks have a lot of sugar, and that can actually make the diarrhea worse. So for the fluids that you can use, the ORS, the coconut water, and even water if you don't have those things on hand, there's a special way that we want you to give it as well, because how you give it can actually make the vomiting worse, and we don't want that. So we need you to give a small amount, but very frequently. Give what we call sips. Now, when we say sips, we mean like 1 to 2 teaspoons, that's 5 mils to 10 mils, every 5 minutes or so, every 5 to 10 minutes. 5 mils for your younger children, and then 10 mils for the older ones who can handle a little bit more. Our babies who are less than 3 months old, though, we don't want you to give ORS or anything else but breast milk or formula. That's fine for them. But the older ones, you give them those other fluids, and you give them small amounts frequently. Now, if your child is not having excessive vomiting with that amount and they're tolerating that very well, you can try to give them a larger volume. So 1 ounce to 2 ounces, that's 30 mils to 60 mils. And you can give them that volume every 20 minutes and see if they keep that down. So Once they're tolerating that very well, you can start to keep them well hydrated with fluids frequently for a day or two, because they probably may not have a very good appetite right now anyway, but we're more interested in how hydrated they are. We know the appetite will come back when they start to feel better. By about day 3, they probably can handle something that's easy to digest, like soft food and soup. And by day 4, they probably can get back to their regular diet. Now, if the problem is primarily the diarrhea and not so much the vomiting, then you can keep them as hydrated as much as they will take. And you try to keep up and be sure in both the vomiting and the diarrhea to be checking to make sure that they're still having good urine, they're passing a good amount of urine. Now, sometimes you're doing all that you're supposed to be doing and you still find that, boy, the vomiting just won't stop, or you just can't keep up with the amount of stool. They can't drink as much as, the amount of loose stool that they're having. And that is the time that we need now for you to think about going for help. So I alluded to it before that we're looking for signs of dehydration. And that is when we're going to really need to know, do I need some extra help with this? So to be clear, the signs of dehydration that we're looking for is if there's less or no urine, if those eyes are sunken in, looking very deep in their faces, if they are not very active at all, not easy to arouse and not interacting with you, they have a change of behavior, they're very aggressive or they seem very confused, the mouth is very dry, they're not crying with tears. Those are all signs that dehydration is happening. And it's important to treat dehydration because it can affect the brain and it can affect the kidneys. And when it's very severe, it can even cause death. So we really need that if you're seeing these signs, don't watch it at home. Take them to your pediatrician or take them to the hospital where a doctor can assess and see if they may need even to be admitted to hospital. No, I know that's not what you want for your kids, and truly we don't want to have to admit them either, but we do want them to be happy and healthy and well. So be prepared if your pediatrician says, we're not getting anywhere with trying to give hydration by mouth and we might have to admit baby to hospital or even watch them overnight, if not admit them to a ward. Okay, so just be prepared. Keep that in mind. You might then ask, well, Dr. Brown, I just want to know if there's a way that I can prevent it from happening altogether because I don't want my child to have GE at all. And that's a good question. But in medicine, we can't ever 100% prevent anything from happening. And most children in the first couple of years of life, they may have at least 1 to 2 episodes of GE. But there are some things that you can do to make it better or to reduce the likelihood of them having GE. And that starts with what we talked about before. So good hand washing. Teach your kids good hand hygiene. Sing with them for that 20 seconds as they wash their hands. Teach them when to wash their hands, before and after they use the bathroom, before and after they eat. And make it a family thing. Make it fun so that they know that it's important to keep your hands clean. The other thing we can do is give probiotics. Now, to tell it shortly, we have good bugs and we have bad bugs. We know the bad bugs are the ones that are causing the problem to begin with. But we also have good bugs. They live on and in us already. So what probiotics do, they really are just another set of the good bugs which help to bolster what we already have, particularly when we're having these bouts of GE. They kind of help to make it a little better. They can shorten the course of the GE or make the loose stool not as bad. And then one other thing that we can do is we can give vaccines. Now, remember we spoke about viruses causing the problem mostly, and there's one particular virus that seems to be the main culprit for children particularly, and that's rotavirus. And so because of that, vaccines have been created to prevent against the main types of rotavirus that seem to cause severe GE in children. And it can be given alongside your regular vaccine schedule. Now, it's not offered in our regular vaccine schedule here in Jamaica, and it must be given or at least started before your child is 15 weeks old. So if you're thinking about getting rota to kind of protect your kid from getting GE, talk to your pediatrician early. not going to say the child will never have GE, but they found that it helps to reduce the severity of the GE and sometimes really does prevent them from getting any GE at all. So it's a good thing to think about, to talk to your pediatrician early. And there's one last thing that we have to talk about, and that is toddler's diarrhea. Now, this is a diarrhea where your child is having loose stool, but they're happy, they're active, they're running around, they're playful. And what we find with these kids is that they tend to have a lot of juice. Now, remember we said earlier that we don't want you to give sports drinks and juice when you have GE because it can make it worse. And it's a similar kind of mechanism in toddler's diarrhea. The juice is helping your child to have a lot of loose stools. So these are kids who tend to have 3, 4, 5 juice boxes for the day. So cut back on those, and I'm sure that you will see some good benefit to what's happening with the child's stool after you do that. So that's it for us on Pocketbook Pediatrics today, and I really hope that things are a little bit clearer for you with what GE is and how it can be managed at home, and especially I hope that you now know what the signs of dehydration are and when to look for help. Please don't watch it at home. Go get help. And sometimes remember, yes, it may require that there's admission to hospital, but we're doing our very best to get them back to you both happy and healthy. Thank you so much for watching. I look forward to seeing you the next time on Pocketbook Pediatrics. God bless.